Sweetser is stepping in as the new mobile crisis provider for Kennebec and Somerset counties, taking over those services from Kennebec Behavioral Health as part of a planned transition. Well, here to tell us more about that transition and how people in the region can access mobile crisis support is Sweetser's Director of Crisis Services, Elise Chase. Elise, great to have you in studio here today. So what's changing for Kennebec and Somerset counties?
Yeah, so Sweetser is so excited about this transition. First and foremost, crisis services are not going away. We have been working very closely with Kennebec Behavioral Health team and really providing warm handoffs with our community partners. We've been in touch with schools, hospitals, law enforcement, other agencies that we really work with to ensure that we are providing good support for the communities that we serve. Having physical locations is really important to us, so we are working on securing office space in both Somerset and Kennebec County, so individuals have access to on-site support, and it's really about delivering those services to our central Maine communities.
Very cool. So obviously Sweetser does so much already, but why did it feel the need to take this on, and what does it mean for the region?
Yeah, so Sweetser is a leader of crisis services in Maine. We are the largest provider. We currently service York, Androscoggin, Franklin, Oxford, and now Kennebec and Somerset. We also have our options liaisons already established in Kennebec and Somerset. Last year alone, we provided over 3,400 interventions statewide, so this really allows us to deliver consistent statewide coverage to these communities.
Very cool. So let's talk about this a little bit. How does someone know if they are in a crisis?
Yeah, so that can look very unique to the individual experiencing it. Essentially, if somebody's emotional state is no longer keeping them safe or preventing them from being able to function in daily life, that's a mental health crisis. So warning signs might include increased anxiety, suicidal thoughts, depression, anything of that nature.
Okay, very good. Let me see here. What exactly does mobile crisis service look like?
Yeah, so if an individual or family is in need, when they contact us, we provide on-site support. So I like to describe us as the EMS of the mental health field. So we're 24/7 community-based service. We respond to the call, meet with individuals in their homes, community offices, any secure location, and we can provide an intervention. And then they also receive 30 to 40 days of aftercare services with us to really provide those referrals and stabilization.
Okay, and just real quickly, Elise, how does somebody access this support?
Yeah, so individuals, families, and community providers can call or text 988. And they will be routed to a crisis counselor in their area.
Okay, very good. Elise Chase, thanks for sharing that important information and being here today and talking a little bit about Sweetser with us. We appreciate it.